Rights Campaign is the nation's largest LGBTQ civil rights organization. It was started back in 1980, and it was really, back then, it was really more of a politically focused organization, focusing on electing LGBT-friendly candidates and policies, getting policies passed that way. And then its work really expanded in about 1995 with the creation of the HRC Foundation, which is kind of our educational arm, which is where I work, doing things like working to change institutional policies and practices. So we like to say the places that impact people's everyday lives. So where they work, where they go to school, where they get their health care, where they worship. So we have programs that are working on integrating best practices and policies in all of those places, in addition to sort of the legislative lobbying work that we're doing at a local, state, and federal level to get LGBTQ equality, non-discrimination passed for everyone. The big differences in rural versus urban is obviously going to be access to care and the number of providers that are available, and then whether or not those providers are going to be LGBTQ friendly. If you have, a huge menu of providers to choose from, you're likely to find some that are going to be LGBTQ friendly and culturally competent and aware. But if you have a very small slice, that's going to be a lot harder. So some places you may only have one hospital in town, and it may be a critical access hospital. It's the smallest of the hospitals there are, and they may not have the capacity to have really invested in kind of the best policies and practices around LGBTQ competency. So in some places there are no providers. We work with a lot of youth gender clinics that are working with transgender youth, and a lot of times we hear of families who travel hundreds of miles to go to a clinic that focuses on that kind of specific treatment that they need. A lot can be determined at the state level or even sometimes the city level. So state level protections, for example, some states first of all, starting with the very top, the federal government, there are no non-discrimination protections for LGBTQ people. A lot of people think that there are, and they just, sometimes it's people who live in places that already have those protections, and then I think, oh, well, everybody has these protections, but there is no national non-discrimination protection in federal law. So that's why HRC is working on promoting passing the Equality Act, which would provide that level of protection at the federal level. So since we don't have that at the federal level, we have then a patchwork of state laws, and sometimes municipalities, cities will have passed laws, non-discrimination laws. So you have all these different levels and this kind of quilt of laws that impact people. And those are just the basic non-discrimination laws. Public accommodation laws sometimes include non-discrimination provisions. And then at the state level, we also look at things like some states have specific patient bill of rights, and sometimes those include sexual orientation and gender identity, and sometimes they don't. And you'd be surprised, some states, like New York, actually only include sexual orientation, but they don't include gender identity. So even though, you think of New York City as having all these rights and benefits, the state law kind of prevails in terms of having a patient bill of rights that is not fully inclusive. And then there's a lot of other things that happen, like state insurance commissions sometimes have some regulations that impact access to transgender health care and guarantee that access, whereas, and then some state legislatures are promoting bills that try to take away rights. And just recently in Pennsylvania, for example, we saw the state legislature try to take away some transgender-specific rights for youth. So fortunately that failed, but we imagine they'll be coming back with it again. The Healthcare Equality Index was started back in 2007, so we just celebrated our decade of that, and it looks at a wide range of policies and practices that we promote to largely hospitals, but other healthcare facilities to promote LGBTQ inclusion. So we started out really focusing on some foundational policies, and that was to have a patient non-discrimination policy that is LGBTQ inclusive, to have an equal visitation policy, and to have an employment non-discrimination policy that is LGBT inclusive. So those are sort of the foundational policies. Those plus training on LGBTQ issues are the things that we really focused on for a very long time. But then over the years, we've been adding a lot of recommendations about other ways that and other best practices that hospitals and healthcare facilities can be inclusive. So that could be anything like, creating a welcoming environment by making sure that you have posters and things that are representative of the LGBT community, having transgender inclusive policies to make sure that staff know that they should be treating their transgender patients with respect, using the proper names and pronouns, things like that, respecting people's privacy, ways to engage with the LGBT community, having a hospital support a local pride celebration, those kinds of things that, there's a whole range of best practices. We probably ask about 50 or 60 questions about different policies, practices that they can engage in, and suggestions about how they can engage. And again, we mainly focus on hospitals, but we also have some outpatient settings, so some frequent or federally qualified health centers, FQHCs. I was trying not to use the acronym. Also some Planned Parenthood affiliates and some other outpatient settings like that. The Equality Act would provide consistent and explicit non-discrimination protections for LGBTQ people in across all key areas of life. So employment, housing, public spaces, public accommodation services, federally funded programs, and jury service. We would love folks to join our membership. We have over 3 million members and supporters nationwide, and we do lots of political activism with them, so that is the best way for them to get engaged so that they can stay in touch. We can send them action alerts when there's things happening, very important things that they can make their voice heard, whether it be at the state, local, federal level. So for example, right now we're working on the proposal from HHS on the conscience proposal. We also call it the license to discriminate proposal, which we have sent out an action alert to our members, encouraging them to submit comments on this proposal, to engage with HHS and tell them that this is an unnecessary regulation, and tell them their stories about discrimination and why they shouldn't be promoting it. I think the biggest barrier is really around fear of discrimination. A lot of folks have experienced discrimination. One study had 56% of LGBT people experiencing discrimination, and 70% of transgender people having experienced some discrimination in a healthcare setting in their lifetime. And when you experience discrimination like that, then you don't want to go back. You're afraid to see any provider, which means that you delay care, and then that's going to obviously create further problems. So discrimination, I think, is one of the biggest barriers to care. Just fearing that people aren't going to, treat them well or know how to treat them. I think there's also other barriers in terms of just a lot of issues related to disparities or related to the stigma that people face and around being LGBTQ. So that creates a lot of problems as well. We have an administration currently that is working on dismantling protections that we've had in place and putting up further barriers. And that has a lot of impacts in terms of health, which I like to think about because that's my job. If somebody doesn't have non-discrimination protections where they work, they're at risk of being fired. People's employment is the number one place that they get their health care. So you have, that's one very tangible way that this impacts people. If somebody doesn't have access to work, they may not have access to health care. And then this administration is also trying to dismantle the Affordable Care Act, which was another avenue for people to have health care. And so by doing things like that, they're really tangibly impacting people's health and well-being. There are several ways that the grassroots can play a role in this. One is they can speak out when these bills are coming forward in their states. So we have, like I said before, we have kind of this huge network of folks that we activate whenever there is a bill pending in their state legislature. So I live in Maryland. I get emails. Fortunately, right now, Maryland actually has a good bill that we're working on passing that would ban conversion therapy. But, HRC is sending me emails as a citizen of Maryland, to get involved, to write to my legislators, to go to lobby day, to help pass that bill. We're doing the same kinds of things to help defeat all of these bills that are anti-LGBTQ. So that is one great way that folks can be involved, and the grassroots can mobilize. They can also, tell their stories to their lawmakers about why they shouldn't support these bills. Yeah, so the other way that the grassroots folks can make a difference is by turning out to the polls and going to vote, registering to vote, organizing for candidates that are going to support LGBTQ equality, and working to defeat those candidates and office holders that are proposing these bad bills. So we have a tremendous opportunity in the upcoming 2018 elections. HRC has identified a lot of what we call pro-equality voters that we will be working to mobilize in key races around the country. So vote early, often. The Healthcare Equality Index 2018 is coming out at the end of March. We have an online search tool where people can find their local hospitals and see how they rated, if they participated. We also research some hospitals to see if they have some of those key foundational policies I mentioned. So just hrc.org/HEI, and then go to the search tool. We also have an online map that's a pretty cool way to look for hospitals as well. We have a very strong social media platform. So we are on Facebook, Instagram, Twitter. What are the other things that I'm forgetting? Because I'm not a millennial.
Okay.
Snapchat. Yeah. So I believe, look for a human rights campaign. You can find us on all of those platforms. And usually we'll also use those platforms to send out our action alerts. So when there is something going on in a particular state, or a way for people to get involved, we post it on social, as well as the stories and other things that we are also posting frequently.